It's a well-established practice the world over. If you're ill, you see your GP, they give you a prescription, you go to the pharmacy, you collect your medicine. But now GPs here want to dispense the medicines as well. It was Susan Mitchell's story in the Sunday Business Post, and we're joined now from our Limerick studio by Dr. Yvonne Williams from the National Association of GPs, and with us in studio here, Daragh Connolly, President of the Irish Pharmacy Union. You're both welcome. Dr. Williams, first of all, do you want to put pharmacists out of business?
Absolutely not. What we're talking about here is just a continuation and a regulation of something that doctors are already doing in the evening out of our services overnight, and often actually during the day when we see somebody who's sick. We quite frequently would dispense a dose of perhaps Calpol or Nurofen to a sick child with a fever, or someone who's injured themselves will get a dose of a painkiller from a doctor in the surgery, and patients are quite pleased with that type of service from us. So why do you want to extend it? Well, we feel that at the moment there's a deficit in funding into the primary care sector, and we're looking at finding solutions to try and reduce the huge bill that is spent on drugs at the moment, and hopefully some of that money may be directed back into the community so patients can get more timely access to perhaps a dietitian, a physiotherapist or an x-ray or ultrasound in the community. So it's about finding money somewhere in the health service that will benefit patients in the community.
Daragh Connolly, doesn't that make sense? Cut out you, the middleman.
Believe it or not, the third biggest killer in the United States of America is medical error. So that's coming after coronary disease, and it also comes after. What we're looking at here is a situation where there is a fail-safe stopgap that's in the process of medicine as it is prescribed by doctors, and there's that fail-safe is there, that the pharmacist checks the prescription and makes sure that this is the appropriate medicine at the appropriate time for the appropriate person. What we're looking at here is if we cut out pharmacists and the skill that the pharmacist has in being able to do that, in working with doctors like Yvonne or the doctors that I work with in my practice in Dungarvan, what we're looking at is a system that cannot be safer. The statistics would say that there could be anything up to 5,000 deaths a year through medical error.
So you're saying GPs are not trained or not qualified to dispense medicines?
GPs are highly skilled and highly trained at what they do, just as pharmacists are highly skilled and highly trained at what we do. We look forward to working with people in a collegiate manner and working in a team. However, if you start to unravel that team, the ones who suffer are patients. It cannot arrive at a situation where there are safer outcomes for patients if pharmacists are less involved as opposed to more involved. In fact, if you even look at the current programme for government as is about to be implemented, it's in the programme for government to expand the role of the pharmacist. Well, that's what I was
going to get on to. I mean, you want to do their job. You want to do the GP's job. You want to diagnose.
Look, I think we may be looking at the way the doctor works and the pharmacist works in something that may look a little bit like Downton Abbey. We're in the third millennium after the birth of Christ. This is a really, really important job that pharmacists do in backing up GPs as they back us up in the job that we do. What we're looking for is better outcomes for people. We're not going to arrive at a situation where it's safer for patients if the pharmacist is taken out of the system.
Dr. Yvonne Williams, is that what this is about from the GPs? Are you trying to scupper the pharmacist's plans to encroach on your territory?
No, I mean, this is something that's already happening. We have about 108 rural dispensing GPs throughout the country who provide a service where there isn't a pharmacist in the community. And, I mean, the figures from the Medical Protection Society, who indemnify doctors in Ireland and the UK, state that there's 1 in 550 medication errors. We're talking about maybe the top 40 most commonly prescribed drugs. Some of these are even available over the counter, things like paracetamol, folic acid, aspirin, antacids, an inhaler for somebody with asthma. So we're not talking about very high-risk prescriptions if used properly, and doctors are well capable of dispensing medications such as this. About 40% of GMS prescriptions are just for a single item, and another 20% would be for 2 items. So we're not talking about very difficult, complicated scripts where obviously the pharmacist's role would be very important, but very simple drugs and a very limited number of drugs, and obviously training would be provided in this area before doctors would start dispensing.
Has she just demolished your argument, Daragh Connolly? They're already doing it. 108 rural dispensing GPs, 1 in 550 errors.
There isn't an argument particularly to make, because even by highlighting that it's happening in 108 cases, those are the exceptions rather than the rules. Best practice internationally says that people work best in centres of excellence, that healthcare professionals work best when they work together. GPs are key members of primary healthcare, but also Dr. Yvonne has just said also that there's dietitians, physiotherapists, opticians, and the list goes on. What's important for us to do is work together and as a team. It is a curious argument that the doctor makes also, because this is the same body that's telling us that they are overworked and under-resourced, that there is a manpower crisis, and that is recognised also within the programme for government as extra GP training places will be enacted. In my own area in Dungarvan in County Waterford, GPs that are retiring cannot find GPs to cover the hours that they are leaving behind. It really makes no sense that somebody would make the argument that doctors should be doing more when the skilled professionals already exist to do it.
Respond to that, Dr. Williams.
Well, just to say, I mean, this is quite commonplace. In the UK alone, you have 6,600 doctors who dispense to almost 9 million patients a year. So to say that this isn't widely done is simply just inaccurate.
You said 108.
108 Irish in Ireland. I'm talking about the UK and the NHS.
So that's 3 per county.
Yes, and it's filling a gap.
That is not widespread.
No, I'm not stating that it is widespread in Ireland, but it's something that has been done
in the UK.
Decades.
So are you going to compare us against the UK, or are you going to come with an Irish solution to this Irish problem?
I'm just stating that this is a commonplace practice, Darren. I didn't interrupt you, so I would like the same respect in return.
But Dr. Williams, if you would respond to the point that a lot of people may find a little bit difficult to understand, is that you want to increase your workload at a time when GPs are constantly lobbying government and complaining, in many cases rightfully, that they've too much work. They're understaffed.
Well, at the moment, every doctor is reviewing their practice, and this may not be something that would suit every practice, but it would be an option for some surgeries and some doctors in some parts of the country. And it's all about, I suppose, modernising your service, seeing what's convenient for patients. And, you know, patients may well like this idea. It's not for everybody, but it is something that we're exploring. And as I said, it's in the very early stages. We are conducting a feasibility study into this area, and we're talking about a small number of drugs and a very small amount of the pharmaceutical drug budget that is spent by the HSE.
And Dr. Williams, how much more will we, the patient, have to pay for our GP service if you dispense?
We're not talking about any cash changing hands in this transaction at all. We're looking at offering the service perhaps to medical card patients, and there would be no changing hands of money between the patient and the doctor. This is about making a service perhaps more convenient for patients and reducing the overall spend on drugs so that the money could be redirected into the community where patients would benefit from better services.
And how much money are we talking about? How much money do you envisage this sort of project generating?
Well, we know from the OECD figures that Ireland has one of the second highest drug spends in the world after the US, so even a saving of 2% could lead to hundreds of millions being saved.
But have you worked that out? Do you know the cost savings?
We haven't worked.
Do you know the cost savings?
We haven't worked out the exact details yet. This is very much in the early stages, and as I said, we are conducting a feasibility study into it, and we will have more details in the coming months.
Daragh Connolly, do you believe this sort of practice will lower the cost of drugs to patients?
I can't possibly see how it can. The value that pharmacists deliver is in the ability to give the right medicine to the right patient at the right time. We are now in a situation where we are practically on par with the cost of medicines as dispensed through the government schemes in this country as they are in the United Kingdom. What is most important in this is that patient safety always has to come ahead of doctor remuneration or fees or new structures that doctors want to come up with. This is a kite-flying exercise with no figures to back it up that works against every single indicator of what is international best practice for dispensing and prescribing. These two things have been separate for generations for very good reason.
Final word to you, Dr. Williams. You're flying a kite here.
Well, they haven't been separate for generations, and as I said, 9 million patients in the UK benefit from this service every year.
Thank you very much indeed to both of you. Dr. Yvonne Williams from the National Association of GPs, Daragh Connolly, President of the Irish Pharmacy Union. It's 8:31 on Morning Ireland. Brian's here with a news update.
Thank you, Audrey. A European human rights